What is colic? It's kind of been a mystery over the centuries, and unfortunately, pediatricians used to kind of pretend that it wasn't a real condition, that babies were just crying for no real reason, but they were actually okay. They weren't in pain. Nothing was wrong with them, and that's kind of that was our pediatrician answer, because we didn't know what caused it, and we didn't know what to do for parents many decades ago. So we tried to tell parents, don't worry, your baby's okay, your baby will outgrow it. There's nothing wrong, there's no pain whatsoever. That was kind of a way to reassure these parents. Now we know, and I think you talk to any parent that has a baby with colic, you'll see it's pretty obvious that those babies are crying in pain. Something's wrong, something's bothering them. And as a pediatrician, it's very obvious to me when I see these babies just crying endlessly in my office. And so, what is colic? I mean, it's basically, it's an intestinal disorder. Something's wrong with the digestive system. Something's causing a lot of digestive pain, and that's causing the baby to cry. And then the baby will spend hours and hours crying. And the baby will be inconsolable, and it's heart-wrenching. And the parents will try everything they can. They'll rock the baby, walk around with the baby, feed the baby more, try to burp the baby extra, go on long walks outside. Parents will do the colic dance, where you're bouncing back and forth with the baby over your shoulder. There's a lot of things that the parents will do, but the babies are totally inconsolable. And this will go on for hours. And that's really how you can know that your baby is colicky, is that the baby's inconsolable. Babies are supposed to be happy. You see those babies all the time. They're just laying there, cooing, gooing, looking at the parents, feeding, sleeping, smiling. That's how babies are supposed to be. That's what every parent imagines, the baby's going to be like. You'll know your baby has colic when not only is your baby having long bouts of inconsolable crying, but your baby may rarely be happy. You're not having those wonderful, peaceful, happy moments. The baby's always unsettled and squirming and grunting and then fussing on and off, besides just, screaming uncontrollably. That's when you know something might be wrong, something might be hurting your baby. The Sears doctors always like to call colicky babies the hurting babies. And we encourage parents to keep going back to your doctor until you've found out what's wrong with your baby. So that, in my mind, that's what colic is. That's how you identify it. It's something, again, is causing a lot of digestive pain. There's also some neurological component to it, in that the baby's unsettled, the baby's extremely fussy. Something, the brain, it just won't calm down, won't settle easily, and that's true. There is some neurological component to it, but I think it all centers in the gut, in the digestive system. So what are the common signs and symptoms? Other than the inconsolable crying, you'll see babies often draw their legs up to their abdomen in pain. They're trying to relieve their gas pain and their bloating. So you'll see a lot of legs being drawn up. You might see the baby, it often comes on after feedings. The baby might be actually fairly happy while the baby's feeding and while the baby's sleeping. But for some reason, shortly after the feeding's over, or during the feeding, or maybe even an hour later, the baby will just suddenly start crying and draw the legs up, and that's how you know the baby's going into a colicky session. I do see kind of a subset of colic where some babies are only colicky in the evenings. You have a fairly happy baby all day long, maybe might be a little squirmy and grunty on and off and unsettled, but then 6 p.m. rolls around, or 5 p.m., and we call it the witching hour, or if only it was an hour, that would be better, but it's like the witching 4 hours, where the baby then spends the evening screaming and crying in pain. There's that evening-only colic that I see as well, but I think that's a minority. I think most of the kids have this all-day-long colic where they're clearly in pain. And I think if you're a parent, if you're not sure if your baby has colic, then he or she probably doesn't have colic. It's usually very obvious, and there's not going to really be any question. So the causes of colic, that's I already talked about how we used to pretend like there was no cause and nothing was really wrong, but Then, doctors started listening to smart parents, I think in the 70s and 80s, and I wasn't a doctor back then, but parents used to began telling doctors, I think my baby's allergic to foods. Breastfeeding mom, would feel that her baby was allergic to dairy products in her milk. And, we didn't really learn this so much through a lot of research. We really learned it from smart moms that were telling doctors something's wrong with my baby, and here's what I think it is. And a lot of doctors caught on, and in my experience, I've seen one of the common causes of colic is cow's milk allergies, cow's milk protein allergies from a breastfeeding mom drinking milk, eating yogurt, eating cheese. All the cow's milk proteins get into mom's diet and get into mom's breast milk. And those proteins come through into the breast milk, and they can be irritating to baby's digestive system. So cow's milk protein is a common cause of colic. Cow's milk formula can also be a cause, just as commonly. Cow's milk formula is the most common formula that infants will use when they're formula feeding, and cow's milk protein allergy is a fairly common situation. So whenever I'm sitting with a colicky baby in my office, if you have a colicky baby right now and you're listening to this, I would say to you, let's first look at your diet. Are you breastfeeding? Let's take cow's milk out of your diet. And some of the time I see that is the answer. The baby improves dramatically. Or if the baby's on a cow's milk formula, I might change to a different formula. However, there's some problems with that, and I'll get to that later. Then what I do, if that doesn't work, and sometimes even simultaneously, what I'll have the mom do is I'll explore the possibility of what I call transient lactase deficiency, or TLD. Transient lactase deficiency is when a baby is partially lactose intolerant. Everyone has the digestive enzyme lactase in their gut, and lactase digests cow's milk sugars or lactose sugars. And lactose sugar is a large component of breast milk, and it's also a large component of cow's milk formula. Babies need lactose sugar. Lactose sugar is very healthy. It's great for the brain. It's great. It's a great energy source for the baby. Lactose is very important. But some of these colicky babies have transient lactase deficiency, and they can't digest the lactose sugar completely. So picture this. Baby gets a meal, either breast milk or cow's milk formula, and it goes through their stomach and into their intestines, and now the baby has to digest the sugar. What if the baby can't? All that undigested sugar goes through into the lower intestines and into the colon, and it turns to gas. It ferments and creates a lot of extra gas and irritation. The baby gets bloated. The baby gets in pain. The baby starts fussing, can't pass the gas. The baby starts screaming, and it's all due to what I call transient lactase deficiency. So how do we help these babies? I think it's common sense. You hear about adults who are lactose intolerant, and what do adults do who are lactose intolerant? A lot of them will just avoid lactose products altogether. They won't drink milk, but they can also take lactase digestive enzymes. You take the lactase enzyme, and it helps the adults digest their milk sugars. Well, the same is true for babies. Babies can take lactase digestive enzymes. And the first available brand, I think the only available brand we have here in the United States, is Colief Infant Drops. And we'll talk about those throughout the program. But Colief Infant Drops are lactase digestive enzymes, very similar to what an adult would take. You give babies the lactase drops with every feeding, whether they're breastfeeding or on a cow's milk formula, and the baby can digest their milk. They can digest the lactose. And then it goes through the system more digested. The baby absorbs the sugars, so it doesn't irritate the tummy. It doesn't cause gas and bloating, and we see fewer colicky symptoms. For many years, we didn't have lactase digestive enzyme drops for babies in the United States. When I found out about Colief Infant Drops about a year and a half ago, that they just came to the United States, I was thrilled, and I started trying them. And I was very happy with what I was seeing. I used to, walk parents through, going off of dairy products, going off of other allergic foods, And some of these babies weren't getting better, and it's frustrating for the parents. It's frustrating for me as a doctor to see those babies keep hurting. So when I found Colief, I started using that, and I've seen it help about half of the babies with colic, colicky symptoms in my office. And about half of these babies were improving dramatically, or their symptoms were virtually resolving. I've been very, very thrilled with it, and that's why I'm getting out there telling parents more and more about Colief Infant Drops. The exciting thing about Colief Drops is if transient lactase deficiency is what's causing your baby's colicky symptoms, you should see your baby improve within 3 days. It's fantastic. There's no test we can do to tell if your baby has transient lactase deficiency. All we can do to determine this is try the Colief Drops over 3 days and then see if the baby improves. If the baby isn't better, I encourage parents to give it 5 days, maybe give it a week just to be sure. But within those few days, the baby should improve. Then you know the baby has transient lactase deficiency. You keep using the Colief. Now, typically you would need to use the Colief for about 4 months. So the baby's about 4 months old. Because what happens is as the baby gets older, the baby starts making more of his or her own lactase digestive enzymes. They start producing more lactase, so they can digest the sugars more on their own. And so then you can wean them off the Colief Drops. And most babies after 4 months will be just fine, and they can move on. And this doesn't mean they're going to be lactose intolerant throughout their whole childhood or their whole life. It's usually just transient. That's why we call it transient. It goes on for about 4 months. Now, if I just to touch really quick, if I have a baby who doesn't improve when a mom goes off of a cow's milk products or the mom tries Colief, then I have a breastfeeding mom take other foods out of her diet: gluten, corn, soy, nuts, shellfish, chocolate, coffee, gassy vegetables. Sometimes the iron and prenatal vitamins will be irritating to moms. So I'll have a breastfeeding mom take other things out of her diet as well.